Hey everyone, it's Dr. Rick. I'm an integrative medicine physician, family practitioner, and sports medicine doctor, and founder of Herbal 411. So this video is from my patients, and it is essentially this. Don't freak out. There was release of information saying that acetaminophen has been linked or could causally be linked to autism. And we give acetaminophen for babies, for pregnant moms that have headaches, for developing fetuses, meaning that during the prenatal stages, if you have headache or a fever or if you have COVID, okay to take Tylenol, also known as acetaminophen. But there's a data analysis that was recently conducted that showed that there may be a relationship between the use of chronic acetaminophen and the potential for autism, especially genetic inheritance, to be blossomed in those patients. So I'm thinking that you're going to hear about debates back and forth over the next couple of months, but there's also going to be COVID and influenza that breaks out in the next couple of months. So the question is going to be for my pregnant patients, what do you do? Or for my new parents, what do you do when you have fever in a kid? Because you go to the immediate care center, and if we can't find anything, we usually just say, take care of the fever, use acetaminophen or children's Advil, unless it's too early in the stage. And then just watch, and if he's not better or she's not better, then you bring him back. And now we're going to have parents that don't even do that. So I have a feeling we're going to have some problems. Now, for the adults that aren't pregnant, for men, it's probably fair just to assume that you're going to be okay with taking Tylenol. I think Tylenol is usually suggested over Advil, especially as you get older, because a lot of people have high blood pressure, kidney damage, or reflux, and you're not supposed to take Advil because Advil, ibuprofen, Motrin, naproxen, Aleve, they all increase the chances of high blood pressure, kidney damage, and gastric reflux or ulcer irritation. So we usually default by saying take acetaminophen, but now people are going to be totally confused. Be careful the data that you hear. You'll probably see debates over the next couple months. But if you're a parent and you have a kid that has a fever, you got to bring it down somehow. And there's old school ways to do it. Ask your primary care doctor, your pediatrician. But if you allow a fever to blossom, especially with a tiny kid who has a big head, they haven't developed, so the body is about twice the size of the head. All that heat that goes to the head, if you don't bring it down to a controlled level, you can suffer from seizures. So fever-causing seizures is definitely a thing. And if we don't control the fever, then you have a problem. So please talk to your primary care doctors about how to handle fever nowadays as we go through the debate over the next couple months into 2026. COVID and influenza will still be here. Influenza is easy to take care of. That the influenza shot is fair to have. But the COVID shot, I'm not going to talk about that. The current variants are rather easy to get through. So talk to your primary care doctor or your immediate care doctor about how to take care of yourself once you have it and the options. But again, for my pregnant moms going through this season, for my moms that are trying to conceive but have a fever going through this season, and then for my parents of newborns going through this season, you have to be careful. But I can suggest a few things. I think that there's data that we have to recognize, and then the data to either confound or support the suggestion that acetaminophen is unhealthy. The reason I have this here is that this has always been useful. I used to use this back in COVID times 2020 when people had coughing and nobody knew what to do with coughing. This is great. N-acetylcysteine is great for decreasing mucus production, also decreasing the sensitivity of the bronchus to irritants and essentially helping with cough. And it also lowers glycogen levels or postprandial glucose levels. That means after your meal elevation in glucose spikes. It helps with that. I have a lot of patients that are going through a little infection, having cough, and also managing their diabetes. This is fantastic. But if we're going to be going through this dance of going back and forth with the research as far as acetaminophen, the basic premise is that a chronic acetaminophen use decreases the glutathione levels that we have over time. So glutathione is, let's just say it's an essential thing that we have in our cells. Every cell has it. and it gets overused, and then your resources decline in the mitochondria. When the resources decline, then you can have expression of, theoretically, the autism gene. Increased chances for autism. So why not just use this? Because N-acetylcysteine also increases glutathione levels in the liver. So the thing that we use this for sure at high doses is when people come in with acetaminophen toxicity, whether it's induced like a suicide or accidental. The liver doesn't like that. When the liver goes through damage from acetaminophen, we usually give this as a rescue in IV form, not in pill form. But just to link why I use it for my patients that have cough, diabetes, sometimes even in pregnancy, if you have polycystic ovarian syndrome, this is great. It seems to dampen the estrogen and testosterone note, but I'll do that for another video. If you have to take acetaminophen and Tylenol, I think it wouldn't hurt to use 600 milligrams twice a day of NAC. I follow Consumer Labs, and Consumer Lab had approved this brand, so I have no allegiance to Now Foods, but they happen to be an Illinois company. I pass by their factories all the time. So this is the first thing I would suggest if you have infection. The other two things I would suggest would be zinc glycinate and then quercetin for helping decrease the reproduction of COVID and or influenza if you get it. But I usually use those for any kind of infection, whether it's bronchitis, walking pneumonia, sinus infection, ear infections. I think the combination is great. Now, I think I'll put a link to the video I did on zinc and quercetin. But NAC is a perfect pairing if you do have sickness. If you don't have sickness and you just need to use Tylenol for some reason and you're pregnant, then I would use this. There haven't been enough studies on using NAC in infants that you have to give Tylenol for, so I can't comment on that. But if you're trying to conceive, if you're pregnant and you do have issues with a fever, for example, or aches and pains from back pain, and you want to take Tylenol, it'll be fine. I think you're still safe until the debate finishes. I think this is great for boosting your glutathione level. For those of you who might have fatigue and infection and difficulty with sleeping and or conception, there's another thing that I would suggest, and that's melatonin. Both these two things were talked about highly during the COVID years, that when your resources in the mitochondria are all utilized and burnt up because the virus, whether it's COVID or influenza, just hijacks your system. It takes away all the energy of every mitochondria and uses that energy to replicate the virus. Well, after the virus is killed, whether you use Paxlovid or Tamiflu, you have cells that are supposed to produce energy that are just, they have no resources. And I think one of the best things to rebuild those resources would be taking a multivitamin, especially B2 and B3. Those two are usually burnt up. And then melatonin. I used to check melatonin. I'm not talking about the melatonin that you need for going to sleep. I'm talking about the other melatonin. So the melatonin is also used as a pulse to help you initiate sleep, but it's also used during the day, has, again, building blocks for the mitochondria to work properly. So don't do massive doses. I think that 2 milligrams would be fine. This was also approved by Consumer Lab. Yeah, it's 2 milligrams per gummy. The only problem with these guys is I don't like the sugar coating on the gummy. It makes me think that my sugar is spiking at night. So I just use this for times when I'm trying to adjust my sleep, especially after coming back from a hiking excursion or travel abroad. So I think it'd be worth it for those of you who are exhausted with chronic fatigue. This helps. If for those of you taking Tylenol, if you want to buffer psychologically, this helps. If for those of you with cough, this helps. For those of you with cough, Tylenol use and diabetes, this helps. So please consider it. Do your own research though. As far as melatonin for breast cancer, I think I've done videos on that. As far as melatonin for recovering from chronic fatigue and post-infection, let's just call it post-virus, I think it's great. And you can use this for months. The only problem is certain brands, 50% of the stuff you find over the counter doesn't really have in the capsule, gummy, or a tablet, doesn't have what's on the label. So you have to be cautious as they're not really regulated like prescription medicine. So hopefully this gives you a couple of ideas. The reason I'm putting this here is I did do a video on near infrared, And near-infrared also boosts up levels of glutathione indirectly in addition to melatonin. Put your comments down in the comments section if you have used your own version of NAC, NAC, N-acetylcysteine, or melatonin, or how you get by with controlling temperature if you're pregnant and or trying to conceive or have polycystic ovarian syndrome. And please consider subscribing. I do this for my patients to empower them to lead a healthier life. Otherwise, stay healthy, and I'll see you at the next video.